Hundreds of thousands of tents in Idlib lined up by the Turkey-Syria border. Most are overcrowded and lack basic facilities. And many living here are worried that makes them more vulnerable to an outbreak of coronavirus. Aid workers here are briefing people on how to cope if there is an outbreak.
I don't know anything about it. I just heard. I'm learning about it now.
Some say inadequate sanitation puts them at greater risk.
Protection? Come on. We lack water. How can we wash our hands that often?
They are getting help in sterilizing tents and houses. But in a country that suffered 9 years of war, much infrastructure is damaged, medical supplies are insufficient and health workers scarce. Health officials are warning that about 100,000 people could die in northwest Syria if they don't get the supplies and equipment they need.
We just have 100 ICU beds, and we just have 30 ventilators for adults. And when we speak about response for corona, we have to mention about the number of adult ventilators. Those ventilators serve now 3.2 million persons. So now I can say that we don't have one empty ventilator ready to receive corona patient.
This device is one of only 3 in Idlib that can detect coronavirus.
We received 3 test kits for COVID-19 yesterday from the World Health Organization. Each can do 100 tests. It won't be enough for millions, but at least we can confirm if we have a case.
So far, blood samples from just a few people have been studied. The government has confirmed some cases of the virus across the country. But as the fight is ongoing here, so is trade, and that contact with the outside brings the risk of people being infected. Idlib is dependent on foreign aid and donors for medicine and hygiene products. Some health workers here say they have yet to respond effectively to the situation, leaving many who have suffered 9 years of war vulnerable and scared as they face the threat of a global pandemic. Sinem Kösoğlu, Al Jazeera.